Yeah.
So with that, I think we will move on to our last topic, which is withdrawal and termination. And Priya is going to go over the new requirements.
Thank you, Denise. So here the requirements on the surface look like they're, not anything new, but they are new. So the first one's really obvious, right? The informed consent form must include the process by which participants' data will be handled in the event of withdrawal or discontinuation. The next one, 2.92, is really interesting because although a participant is not obliged to provide a reason for withdrawing prematurely from a trial, the investigator should make a reasonable effort to ascertain the reason while fully respecting the participant's rights. So the investigator should consider if a discussion with the participant or the participant's legally acceptable representative is actually appropriate. And this discussion should focus on the reasons for ICH E6R3 guideline talks about, guideline 20 talks about withdrawal to determine if there are ways to address the concerns, such as the participant could reconsider their withdrawal without unduly influencing their overall decision. And here it also talks about the investigator or delegated investigator site staff that they can consider, or they should consider, explaining to the participant the value of continuing their participation in the trial to minimize trial participants' withdrawal. And what's important to note is that in this process, the investigator should also ensure that it does not interfere with the participant's decision to refuse or withdraw of their participation at any time, right? It's up to the participant in the end. The final thing I want to point out here is that it's not a new requirement, but protocol sections more clearly differentiates between withdrawal from a trial and actually stopping treatment. So I think, Denise, you're going to be talking exactly about this on the next slide.
Sure. Yeah, I don't think this is anything new in clinical research. It's just being sort of highlighted here by these changes in R3. And the big challenge I see is that the terminology is confusing. So we sometimes talk about discontinuation from a study, and we also talk about discontinuation from treatment. We talk about withdrawal from a study, but we also talk about withdrawal of consent. And I think that there are three distinct kinds of consent withdrawal, and we might need to start differentiating. So a patient can withdraw consent for treatment. They can withdraw consent for treatment and for all observations and procedures. And they can withdraw consent from follow-up, or they can give consent for part of those things, right? And so we might need to differentiate between the patient who doesn't want any more drug administration, but is willing to come back for visits, and distinguish between the patient that won't do either of those things, but is willing to be called for follow-up, right? And so the question is, how are we going to do that? FDA guidance says that if the original consent form doesn't describe how these various scenarios are going to be handled, then patients should be signing a new consent that specifies their limited participation in the study. And we've seen those on some studies, but not all studies use them. Maybe they will be used more going forward. I think we also need to think about how we are going to train sites to address participant concerns without making it feel like they're being coerced into staying on the study. And so Priya is going to go over a couple of potential questions here.
Yeah, thanks, Denise. So very quickly that, you might get asked by an inspector around how were sites trained to handle participants' issues when they wanted to withdraw consent. Or you might get asked what data was collected from participants who withdrew consent for treatment.
Okay. And then, this is the kind of storyboard that I might put together, summarizing all of the participants who withdrew consent, what they withdrew consent for, the dates that happened, and any data that was collected after their first consent withdrawal, just so that you would have that ready to present to an inspector.